Hello everyone, I'm QRS Terry and I'm with Redox. I'm joined today by Bob Gold. You know, he's a behavior technologist and the CEO of GoMo Health. And it's an exciting interview because you're going to tell us about what GoMo Health does and what you're doing in the space.
I will, Q. So GoMo Health is in the population health care coordination business, and the base of our business is a science called Behavioral RX, and it's the science of personalized patient engagement for population health, and it looks at behavioral and cognitive attributes of people and melds it with clinical data to figure out how to engage people in their daily life at work, home, and play to be more adherent to their complex or chronic condition. So it's used by health systems around the world. We're in about 3 different continents.
Wow.
It's used by payers in their care coordination effort for readmission reduction, and especially multi-stakeholder network integration to get the PCPs and the specialists together. It's used by pharmaceutical companies for medication therapies, especially around specialty pharmacy and complex drugs. And we're doing this with close to 8 million patients a day.
Wow.
Across about 20 disease states, so it's fascinating.
Yeah, totally. So what prompted you to start GoMo Health?
Okay, so the motivation was for 24 years, my science is the science of human motivation and persuasion, and my subspecialty is digital to human motivation and persuasion. So it's been, prior to health, it's been working with NASA on human factors for astronauts of where to put the knobs because they have to make a quick decision. Mm-hmm. It's with the Marines on their pilot aircrafts, like what are the behaviors and cognition around that. So I've studied this in a lot of fields, and a while back, about 10 years ago, kind of both my parents died unexpectedly of health issues.
Sorry to hear that.
Yeah, thank you. And I decided to devote that science to healthcare. So that's kind of how it started. And we're really excited because we have tremendous outcomes, both from bringing back joy in practice to clinicians by our software acting as their virtual assistant in the care coordination, to patients, to reducing cost, and just really helping the whole care continuum and trying to change healthcare from an episodic encounter to looking at a person's life and the patient's journey across the long haul. So basically it's treating the person, not the disease. So it's exciting, it's working. We have about 40 people in the company. We're
Wow.
in Asbury Park,
That's
New
amazing.
Jersey.
Okay.
And we're having a blast.
Got it. And so earlier you described it as almost like a Siri, but as like a virtual nurse in some elements, right?
Yes.
So do you think nurses will be replaced by like software in the near future?
No, you know what? It's a great question. Absolutely not.
Okay.
Now here's the interesting thing. The real question is, in the new value and risk-based reimbursement model, in the new business of health, what is the right blend of human and digital care coordination? What's the right blend of where nurses, let's say, or case managers or a social worker comes in versus the use of technology? And I could tell you, most of our clients, when we start with them, they don't have a science or methodology at that. They have humans who do care coordination, they throw technology at it. But there's not a seamless conversation flow between the two. So that's the real question. It's how do you make the existing care coordinators or nurses more productive, feel better about their day, and assist them so they can spend more time on high impact medicine, right? And not all the perfunctory tasks.
Totally.
That's the real question to ask.
Got it. So in your practice and in your day-to-day efforts, what are some of the biggest limitations that you're facing currently?
So it was interesting, when we first started maybe 5 years ago, we would go to we went to healthcare, and they said, well, I understand your science, it sounds good, but we're building an app for our patients, or we're building a portal. Now that was the biggest obstacle, or we're sending text messages or email,
right.
Now I'm getting calls back saying, hey, we did that, but it's not working. We have a portal, I get 5% adoption.
Right.
Like, so what was that personalized? How do you do that now? So I would say our biggest obstacle is no one in the world except for maybe our 60 different healthcare clients know about us, right?
Yeah.
So it's a matter of sort of getting the word out.
This video will change that.
Change it completely.
Yeah, you know, the world is right here.
All right, I like that. You know, Redox Q is pretty good, by the way. So, you know, and the interesting thing is getting the leaders in healthcare to think about their business differently. I'll give you an example.
Okay.
So healthcare needs to move more to what consumer products have done, and they're starting to recognize it, right? So you'll see in hospitals, they'll have a title of a concierge. Some of them now, it's customers, not patients, right? So if you think about it, why doesn't healthcare have loyalty types of programs? Why don't they engage consumers and help them in their life, not just when they have a problem?
Right.
But how do you do that from a business perspective? What's the P&L model? Who do you hire?
Right.
Right? Is it healthcare people? Is it consumer intelligence? Right. So that's what we like to work with our clients on. Well, you know, helping them through the new care continuum.
Right. Because the organizations, they don't make money if people are healthy, and like they need to make money to sustain their organizations.
Well, but interestingly enough, that used to be how they looked at it.
Yeah.
And clearly, you know, if you look at specialty practices, like oncology or orthopedics or neurology, that's where your higher, let's say, revenue, higher margin, more complex cases are. But what they have to become better at is how to capture a person through their life cycle, like an American Express would look at it, or Starbucks would look at it. So, in other words, if I could capture, let's say, a woman in the 20s, and then help her give birth and her kids, and then get her kids, and then she's the decision maker on health for the household. You know, so it's not so much wait until someone has these issues. You follow? But that's not how it's worked in the past. So how do you do that? So, what is the strategy?
So data-driven decision-making in healthcare, like, is that what you're getting towards?
No,
or?
It's a good question. Interestingly enough, we're about little data versus big data. I'll explain. Our system's like a bot. We're interacting with people. It's similar to like a Siri, but it's more proactive. So we're asking you questions, we're telling you things to do, but we're responding to you like a real human, okay? And then we're able to give you over to a human if we see a potential adverse reaction, or a potential ER visit, or whatever it may be. But we're reacting to you. So if you say on a scale of 1 to 10, if you told us 2 days ago an 8, yesterday a 7, today a 2, we're going to react to that. So it's more real time. We don't necessarily, because some of the big data analysis may be a little old. But we're reacting to you right now. So if you're having a little episodic event or you're stressed, I'll give you an example. Over 50% of patients who come out for congestive heart go back to an emergency room because they're stressed, nothing to do with their heart, and they ask to see a cardiologist. Well, what does a hospital do for that? How do you get them to maybe be less stressed and not do that? So we're actually looking at in the moment real data, and for the first time, we're able to then later collate lifestyle actions to our system with clinical data to give predictive models and insights to big data.
Wow.
Okay, but
so it's like a loop.
We're a little data. Right? It's kind of neat. It hasn't been done before, right? Because just because all the analysis about you says A, doesn't mean that's the case. I'll give you a little example. A lot of times when we start with a client, they will give us a profile of risk. They'll tell us these patients are low, medium, high. It's all based on clinical data and claims, and we go to them, that makes no sense. Patient A, their lifestyle, how they're dealing with the behaviors and cognition issues, is more risky, even though they're medically less, because they're more likely to go to emergency room, they're more likely to not follow a medication therapy. So why aren't they a higher risk? And they're like, oh, we haven't thought about that, and we don't have a way of doing what we do. So that's what we work together on. So little data versus big data.
But it all plays into the cycle of data, you know?
It does.
It's all one. It's
It
data.
does,
Yeah.
100%.
So, with that being said, and with the current state of the environment and industry that you're in today, like, what does GoMo look like in 5 to 10 years from now?
Well, hope I don't gain weight and, I'm going bald, but
Sure, Elon Musk can fix all that.
all right.
Yeah, he's going to get his.
I have to personalize the brand, right?
Yeah.
So again, what we're doing, we have, like I said, about maybe 8 million patients we deal with a day. In 5 years, and 90% of that's in the U.S. market.
Okay.
So I wanted to get it up to 50 million patients a day.
Yeah.
And have about half our business in the U.S. and half in other countries. For example, we have live program in Kenya at Aga Khan Health System.
Wow.
For pregnant moms.
Yeah.
Then we're doing postpartum programs. We're going to be doing a diabetic program. We're talking to South Africa now about doing programs. So my goal is to get the science, the method, and the concierge care system used throughout the world to make it a better place to be for everyone in the care continuum. That's our objective.
Well, Bob, this was awesome. Thank you so much for your time. I have one final question.
You got it, kid.
And where can the world find out more about GoMo?
Oh, you can go to GoMoHealth.com. That's probably the best place to find out about us.
Awesome. Well, thank you for your time. It was
You're
a
welcome.
pleasure. Yes.
Thank you.